Pneumoconiosis with an S. Definition of pneumoconiosis according to International Labour Organization. Pneumoconiosis, notice I in the spelling. Pneumoconiosis is the accumulation of dust in the lungs and tissue reaction to the presence of the dust. Pneumoconiosis with E between the two S's is plural of pneumoconiosis. So pneumoconiosis is the phenomenon, and there are different types of pneumoconiosis with E. Dust within the size range of 0.5 to 3 microns is the one which poses maximum risk because these can easily enter the alveoli. Particles larger than 3 microns do not reach the alveoli. They are trapped before alveoli in the cilia, in the mucous lining, and are gradually pushed out towards the larynx and coughed out. And particles smaller than 0.5 microns are inhaled in and exhaled out, and so do not deposit on the alveoli. Dust particles which do get deposited in the alveoli, they cause inflammation in the lungs because they are foreign bodies. And this inflammation can eventually lead to fibrosis of the lung tissue, thereby destroying the alveoli, being replaced by fibrous tissue. Pneumoconiosis is derived from the Greek words pneuma and conis. In addition to causing fibrosis, the deposition of lungs in the alveoli and bronchioles leads to reduced ciliary clearance, that is, ciliary movement is also hampered. The chemical composition of the dust may be cytotoxic, so it kills the various macrophages. The very macrophages which engulf the dust particles are killed, and some toxic chemicals may be released. Some dust may cause more fibrosis than others. For example, silica is more fibrogenic than others, whereas coal appears to be relatively inert and it accumulates in sizable amounts with minimum tissue response, and it takes a higher amount of carbon to accumulate in the lungs to lead to pneumoconiosis. Mostly this exposure to dust, this much exposure to dust, occurs as a result of one's occupation. Hence pneumoconiosis are included under occupational diseases. The specific type of pneumoconiosis are named by the substance which is inhaled. For example, silicosis, asbestosis, anthracosis, etc. Now, everyone who is exposed to dust may not be affected by pneumoconiosis. What are the factors which affect the development of disease? Chemical composition of dust particles. We have discussed that some kind of dust may be cytotoxic, others may be fibrogenic. Size of dust particles. Fineness. If it is coarse dust, then the particles do not reach the alveoli. Concentration of dust in the atmosphere, that is the load which is inhaled. Duration of exposure, for how long a time the person has been exposed in those environments. And individual susceptibility or health status of the exposed person. A person may develop pneumoconiosis earlier than other. A person may already be having compromised lung functions. A person may already be having some lung infection. Pneumoconiosis usually takes years to develop, but once it develops, it usually progresses even after the exposure has been discontinued. There is no cure for pneumoconiosis, hence prevention is essential. This table gives the pneumoconiosis caused by various types of dust. Coal dust, the pneumoconiosis is known as anthracosis, silica, silicosis, asbestosis. It can also lead to some cancer of the lung. Iron, sidrosis. Then organic dust. The reaction is mostly hypersensitivity to the organic dust by the lung tissue. Sugarcane fiber exposure, bagasosis, cotton dust, bicinosis, tuberculosis, hay or grain sand leads to farmer's lung. Next, silicosis. Silicosis can cause permanent disability due to lung function compromise and increased mortality. The cause for silicosis is inhalation of dust which contains either free silica or silicon dioxide. Silicosis was first reported in India from Kolar gold mines. Silica exposure occurs in the following types of industries. Mining. Mining of so many things, because mining involves digging up of the area, creating roads on which carts and vehicles move on dusty roads, the machinery moves. So there's a lot of dust blowing around in the mines. So mining of coal, in addition to coal dust, mining of coal also has silicosis. Mica, mining of gold, silver, etc. Then pottery and ceramic industry, sandblasting, metal grinding, building and construction, rock mining, iron steel industry, etc. all lead to silica, can expose to silica exposure. Higher the concentration of free silica in the dust, greater the risk of developing pneumoconiosis. Longer the duration of exposure, the greater the risk of developing silicosis. Incubation period may vary from just months to 6 years of exposure. It depending upon the factors that we have already discussed. The amount, the total duration of the day when the person is exposed, the previously compromised pulmonary function test or not, etc. What happens? The dust particles are ingested by phagocytes. These loaded phagocytes, they block the lymph channels and cause injury and fibrosis. Pathology means lung biopsy will show dense nodular fibrosis. Nodules range from 3 to 4 millimeter in diameter. Clinically, the onset is insidious. Early manifestations include irritant cough, dyspnea on exertion, and pain in the chest. This is true for most pneumoconiosis. Impairment of total lung capacity is common in advanced stages. Lab investigation X-ray shows snowstorm appearance. Silicosis has been known to increase the proneness to tuberculosis. There is no effective treatment for silicosis. Prevention and control of silicosis include rigorous dust control measures, regular physical examination of the workers and removing them if found lung function tests are found diminished. And silicosis, once identified in a person, it is a notifiable disease. It should be notified to the authorities under the Factories Act and Mines Act. Anthracosis is due to inhalation of carbon dust, most likely to occur in coal mine, and hence the pneumoconiosis, the resulting pneumoconiosis is also known as coal miner pneumoconiosis. There are two phases in anthracosis. Simple pneumoconiosis. Here the coal dust keeps accumulating with little ventilatory impairment, that is little effect on the ventilatory on breathing capacity. Around 12 years of exposure is required for this phase to appear. The second phase is progressive massive fibrosis. Here fibrosis starts and progresses fast, leading to severe respiratory disability and frequently results in premature death. Once a background of simple pneumoconiosis, that is the first phase, has been established, progressive massive fibrosis may develop even if the person is no more exposed to coal dust or carbon dust. It has been observed even before the anthracosis was known that the risk of death among coal miners everywhere has been twice compared to the general population death rate. Coal miners pneumoconiosis or anthracosis is a notifiable disease. Hence, if it is diagnosed, to be notified to the authorities under Indian Mines Act. Also, it is a compensatable disease. That is, the workman can claim compensation from the employer under Workmen's Compensation Act. Bicyanosis. This is due to inhalation of cotton fiber dust over a long period of time. Symptoms are similar to other pneumoconiosis, chronic cough, progressive dyspnea, ends in chronic bronchitis and emphysema because of destruction of alveolar tissue. Incidence has been found to be 7 to 8% in various surveys done in Mumbai, Ahmedabad and Delhi. Bagasosis is an occupational lung disease and is caused by inhalation of bagasse or sugarcane dust. Here, it was first reported from cardboard manufacturing firm near Kolkata. Why cardboard? India has a large sugarcane industry, and sugarcane fiber is utilized in manufacture. It's not wasted. It is utilized in manufacture of paper, cardboard and rayon and other things. Bagasosis does not occur due to the dust as such. It occurs because this dust is infested by fungus known as Thermoactinomyces saccharine, and this is the spores are inhaled. It grows in this. Symptoms are breathlessness, cough, hemoptysis, slight fever. On pathology, we can see acute diffuse bronchiolitis. X-ray shows mottling in the lungs. If the bottles they coalesce together, it becomes a shadow. There's an impairment of pulmonary function tests. Treatment. If treated early, acute inflammatory condition may resolve and the person may improve. But if left untreated, it progresses further and leads to diffuse fibrosis, emphysema and bronchiectasis. How can bagasosis be prevented? See, the use of sugarcane fiber is a very environmental friendly. We should not simply discard it, and it is being used in other industries, which is welcome. But then the workers should be protected against bagasosis. How can that be done? Dust control. Separation of dust, that is using wet processes, enclosed apparatus, exhaust ventilation for managing the bagasse. Personal protection using mask or respirators which have mechanical filters or maybe which have oxygen or air supply. Medical control. Initial medical examination for pulmonary function in the worker and periodic checkup of the workers. Bagasse control can be keeping the moisture content above 20% so the dust would not blow, and spraying the bagasse with 2% propionic acid. This acts as a fungicide, and the particular fungus which causes bagasosis would not grow. Longer the duration of exposure, the greater the risk of developing silicosis. Incubation period may vary from just months to 6 years of exposure. It depending upon the factors that we have already discussed. The amount, the total duration of the day when the person is exposed, the previously compromised pulmonary function test or not, etc. What happens? The dust particles are ingested by phagocytes. These loaded phagocytes, they block the lymph channels and cause injury and fibrosis. Pathology means lung biopsy will show dense nodular fibrosis. Nodules range from 3 to 4 millimeter in diameter. Clinically, the onset is insidious. Early manifestations include irritant cough, dyspnea on exertion, and pain in the chest. This is true for most pneumoconiosis. Impairment of total lung capacity is common in advanced stages. Lab investigation X-ray shows snowstorm appearance. Silicosis. Asbestos enters the body by inhalation of these fine fibers which may get deposited in the alveoli. These fibers are insoluble. The dust which gets deposited in the lungs leads to pulmonary fibrosis, which causes respiratory insufficiency and early death. Other diseases which can result from asbestos deposition: carcinoma of bronchus, mesothelioma of pleura or peritoneum, which are otherwise rare forms of cancers. Cancer of the gastrointestinal tract. The risk of bronchial cancer is reported to be higher if the occupational exposure to asbestos is also associated with cigarette smoking. This fibrosis is due to mechanical irritation in asbestosis. The fibers cause mechanical irritation and it is peribronchial, diffuse in character and basal in location. The fibrosis is peribronchial, diffuse and basal in location. That is, and this is in contrast to silicosis. You can see the table where it is compared. Asbestosis and silicosis are compared. The reasons are asbestos exposure and silica respectively. The reason for fibrosis is mechanical irritation in asbestosis and lymph blockage by loaded macrophages in silicosis. The type of fibrosis in asbestosis is diffuse and nodular in silicosis. The fibrosis situation in lung is basal location in asbestosis, upper parts in silicosis. You can remember the mnemonic silica goes against the gravity, whereas the asbestosis remains basal towards the earth. Clinical findings in asbestosis: dyspnea, which is out of proportion of the clinical signs in lungs. In advanced cases of asbestosis, clubbing of fingers can occur, cardiac distress, cyanosis. Sputum examination findings are typical. It shows asbestos bodies. These are asbestos fibers coated with fibrin. Chest X-ray, we have seen, shows ground glass appearance in lower 2/3 of lung fields. Once asbestosis is established, the disease progresses even after removal of exposure. So preventive measures using safer types of asbestos, that is the first type, chrysolite and amosite. Substitution of with other insulants. Where asbestos is used as insulant, other things can be used instead of asbestos. Rigorous dust control in the factory, periodic examination of workers, which includes clinical examination, X-rays and lung function, and continuing research into better types of asbestosis and treatment of asbestosis. Farmer's lung. This occurs due to inhalation of moldy hay or grain dust, that is hay or grain dust which is infected by mold. And this farmer's lung is due to hypersensitivity pneumonitis, hypersensitivity to the mold. Grain dust or hay, which has a moisture control of more than 30%, leads to bacteria and fungal growth. And this growth raises the temperature of hay or grain dust to almost 40 to 50 degrees Celsius. These temperatures promote the growth of thermophilic actinomyces known as Micropolyspora fini, which causes farmer's lung. The inhalation of spores of these called farmer's lung. It is an acute illness consisting of general and respiratory symptoms and physical signs on examination. The repeated attacks of acute illness can cause pulmonary fibrosis and inevitable pulmonary damage. Finally, cor pulmonale, that is when a lot of fibrosis has occurred, leads to pulmonary hypertension and cor pulmonale can result. This is of importance because India has a bulk